So this is a fun one for me because I'm born and raised here in Boston. I now live in Miami, so I'm not used to this cold anymore. And yes, I am soft, and some things never change. As I was coming from the seaport, worked out at the Equinox, I'm Ubering over, and that exit, when you're getting off at Dorchester, has been backed up for over at least 31 years. And I texted my mom and sister, and I was like, yep, some things don't change. But luckily, my Uber driver was smart, went up, cut everyone off, and I was like, thank you drive like my mom. And so I always like to start with the why. And so I'm going to share a story about my Uncle David. And I was just chatting with Ryan on my team and how I love the Cape. Used to go there for July 4th. And growing up, we would always go camping, whether it was Cape Cod, somewhere else. And don't ask why, but I would always try to run away. I was a wild little child. And who would come and scoop me up? My Uncle David. He lived in Agawam, Mass. For anyone who's familiar, when you get off that exit at Springfield, you see that huge Superman red roller coaster high in the sky. And no, I never went on that and never will. I don't like roller coasters. But he was my Superman. He helped me do handstands. He had the biggest house. He had a huge pool. His basement was massive. Biggest TV. I played my first video games in his house. His kids, my cousins, were my best friends. And I'll never forget the last time I saw my Uncle David. So now you know I don't like roller coasters. I haven't been camping legitimately since the 90s. Don't tell my mom that. And I do love football. And I don't know if any Boston Latin parents here, but I went to Boston Latin. And the last time I saw him was Mother's Day, junior year. And as he was leaving the house, he said, I'll see you at the fall at one of your games. Unfortunately, he never made it to a game. My Uncle David was dealing with substance use disorder. A few years later, my cousin attempted suicide. 2 months ago, I just lost my step-cousin to an overdose as well. So it's a stark reminder that mental health can affect anyone. And if I even think about my own mental health, I grew up with a single mom, and she was awesome. I don't know how she did it. She was a pediatrics emergency room doctor at Mass General for 38 years, and somehow was still at every single hockey game, every single football game. But I didn't see my dad from age 6 to 18, zero contact. When I was 9, I saw my hockey coach collapse on the bench. Next thing you know, my mom's running across the ice. And while she saved a lot of people over 38 years at Mass General, there was no saving Andy from a brain aneurysm. Right around that same time, I lost one of my best friend's dad to a heart attack. I was falsely ID'd for a stabbing before I was old enough to even have a school ID, let alone a license. So I share these stories because I think we all have one when it comes to mental health. I was on a panel last year with medical director of a large primary care group, and she shared a story about a patient who was seeing one of her doctors and for decades had chronic conditions that they were never able to get under control. And one day, she came into her PCP and said, you know, I'm going to share something with you that I've never shared with anyone else. I was abused in the concentration camps. That was her first foray into mental health. She was willing to then get a therapist. And what do you know? After decades, her chronic conditions start to improve. So you can't talk about physical health without talking about mental health. You can't talk about mental health without talking about physical health. I was with a famous athlete who you would all know, and was having dinner with him a few weeks ago. No, it was not Big Papi, although I have met him and have selfie proof for that. And when he sat down, the first question he asked me, he was like, what's the definition of mental health? And I was like, you know, that is a fantastic question. And while I've been the co-founder of Rula for 6 years, I've never actually been asked that question. And so I said, it's a spectrum. It can go everything from how do I perform better at work, all the way through a true substance use disorder, which can lead to death. So again, I would just remind us all, we are dealing with humans at the end of the day, and especially with your roles, there's no way that you can deal with humans and not deal with mental health. So I have a question. How many of you have heard about Rula before this conference? Raise your hand. Actually pretty good. That might actually be the most I've ever seen. So I think Blue Cross Blue Shield Mass has been doing us a favor. So I always say that awareness is the biggest problem when it comes to mental health. We're one of the largest mental health groups across the country. We have over 15,000 providers in every single state. We have an appointment as soon as tomorrow in any state. But if you don't know about it, it doesn't matter. It'd be like today if someone says, I can't get a ride. It's like, no, you can go to Uber or Lyft. But imagine if you didn't know about Uber or Lyft. It'd be pretty hard to get a ride right now. We're trying to leave here, calling that 2 cabs who's probably around. And a story that really sticks out to me is our employer team was at a Anthem, California employer. That could be any employer, it could be one of you. And we're at a health fair. And a dad comes up to the table and shares he's going through a divorce. And he has a 7 or 8-year-old daughter, and he'll do anything to make sure that she gets mental health care. And as I shared before, growing up with a single mom, I know the impact that divorce can have on youth. And he's spending $800 a month for an out-of-network therapist. And I wasn't there, but the relief on his face when he heard that you could just go to Rula.com, put in family issues, children and adolescents, and he'd be paying his $15 copay, saving $700 a month. I don't care who you are, $700 a month is a lot of money. And the example I always like to give and will continue to give is someone will come and say, I need a female African-American provider who can treat postpartum, is in network with fill in your insurance, and by the way, I can only see them Saturday afternoon. And typically it's been impossible to find that. But today, you can go to Rula, put that in, boom, here are 10 providers, take your pick, see you Saturday. So just bringing that modern experience that we have with almost everything else in our lives and bringing that to mental health. And I just shared a story about that father trying to find care for his daughter. And so now I have another question for you. Can anyone guess what % of high school students have attempted suicide in the US? 30? 20? 10? So 10 is very close. So 9%. 9% of high school students have attempted suicide. 20% have seriously considered it. If you look at black children, they're 2 times more likely to die by suicide. I was at a lunch once and someone shared, back in the day, you didn't get invited to that party. You maybe found out on Monday. By then, hopefully your week's off to a good start. Today, you don't get invited to that Saturday party. You're gonna find out in real time as you're sitting on your couch, Instagram, TikTok, Facebook, pick your favorite one. And it's not just social media to blame. Bullying is on the rise, especially cyberbullying. It's not too long ago that COVID had everlasting effects on our youth. Seems like we have a school shooting every month, which is ridiculous. And why I like to highlight this is as you're thinking about your employees, obviously many of them have children. And imagine if they're going through tough times, how can that employee possibly be their best self at work? It's impossible. And so then if we think about who are the most important players when we're trying to integrate mental health with physical health? Any guesses? Well, first answer is you all. But I always like to start with, you can't have mental health isolated on an island. It's gotta be integrated, especially with primary care. And we chat with a lot of primary care doctors, and they say about 1/3 of their patients have some aspect of behavioral health. And you say, great, what do you do about it? You hear, I don't know. I have 2 therapists who are friends, but they're full for 4 months. I have 2 therapists down the street, but they're only out of network, $300. Or I tell them to call Optum. And we know how that's gonna turn out. And it's not just primary care. Think about specialists, whether it's dietitians, whether it's physical therapists, saw Hinge Health out there, whether it's endocrinologists. They all oftentimes find that their patients are dealing with a mental health issue, and typically they have no answer. And not to pick on my mom, my sister's also a doctor at Mass General, but you get about 30 minutes of training when you're in med school for mental health. The average doctor doesn't even know what to do. So what do you think the average employee or the average person is thinking? And I wanna touch on maternal mental health for a second. I was with one of my good college friends last night for dinner, and his wife is expecting in about a month, which is awesome. But 1 in 5 moms will have depression before or postpartum after giving birth. And can anyone guess what % of them is going to get care? Luckily, it's not that bad, but still horrendous, 15%. So only 15% of moms who are going through a behavioral health issue are going to get the care they need. Think about the impact that has not only on themselves, on their child, on their family. 3 in 5 Black moms will have depression before or postpartum after, and they're 41% less likely to get care. Hispanic moms, 57% less likely to get care. And we're only screening 20% of our moms. So I bet you it's actually a lot higher, which is also crazy that we're only screening 20% of them. But then if you think about some other players, you have other digital health companies, take like an Omada Health, working with employees for diabetes. And I gotta give them a lot of kudos because they're doing a PHQ for depression. And if that employer has a specific behavioral health carve out, they have a nice transition. But the average employer doesn't, and then they're just relying on the health plan, and that's where a lot of time the ball gets dropped. But imagine a world where you're on Omada, you take the PHQ, you think they're just helping with diabetes, and then all of a sudden, 2 clicks of the button, and you can have that mental health therapist that matches all your characteristics and is in network. Or think about Amazon.com. We were one of the first groups that Amazon picked on Amazon.com, so if you search for mental health, we pop up and you can find your therapist who's in network. But then it's also all of you and employers. A lot of people still find out about benefits directly through their employer. And not just benefits, but the rest, anything that falls within the healthcare ecosystem. And so I share this to say there is no one solve. It takes the entire ecosystem to come together. And so then if we start to think about some of the solutions, and I always like to pick a crawl, walk, run kind of framework. And I really, really, really like to emphasize the crawl part. A lot of people, a lot of times, and it's easy, and even me, you get caught up in the, oh, what could happen in 2 years, 3 years? Well, what if we do all these crazy integrations, et cetera? But if you're just thinking about the run phase, you may never do anything. And there are millions and millions and millions of people every day, every week, looking for mental health care. And so what if every primary care provider just talked about behavioral health? What if we just screened every soon-to-be mom or recent mom? The NCAA just came out with a mandate for a screening for mental health for their athletes. Why don't we screen every employee? You get an annual physical checkup. Why aren't we doing an annual mental health screener? Back in the day, some of our first health systems we were partnering with just sent us a secure email to send over a referral. Might sound super basic, just secure email. But guess what? We've helped thousands and thousands of patients because of that, and still do, even to this day. So as you guys are sitting there and thinking about, well, what could I do in the crawl phase? What if Rula came and just did a 20-minute webinar on mental health? What if we created a simple URL, rula.com/ put your employer name in there, that you were able to just email out letting your employees know that they actually have access to Rula? Because again, we're in network with most of the major health plans across the country, already cover over 140 million lives, probably already have served some of your employees. As we then start to think about the walk phase, with many health plans, Blue Cross Blue Shield, Mass being one of them, their member services team, call center, now has access to our direct booking tool. So now if you call in with that same example, I'm trying to find a female African-American provider who can treat postpartum, is in network with my health plan, and I can only see them Saturday afternoon, that member service team can directly book a member. Imagine if all of you demanded that from your health plans, and that was just the norm. Imagine if we were integrated into your open enrollment or your normal marketing benefits calendar, so once a quarter, something was going out for behavioral health. And as we start to get into the run phase, I'm going to describe what we have with Kaiser in California, and now actually with Kaiser throughout the country in their markets. Not only can a member call in, they can directly book you, or they can do it online. We also integrate back with their Epic EHR so that we can share all of our notes and all of our clinical outcomes back with the patient's primary care provider and rest of the care team. And so imagine a world where every health system, take Mass General, you name it, and the primary care providers who are taking care of your employees can directly schedule or send over a referral to one of our therapists, and then we're sharing notes back and forth. And it's not rocket science. With Epic Care everywhere, and HIEs, even if you're not on Epic, we have self-driving cars. It just takes asking the question of why, and a little bit of work from both sides, and we can make that all a reality. Or think about if we were integrated into your benefits admin platform. You log in, you see a banner, or even a payroll company. We've integrated in with some of, whether it's a payroll company, benefits admin, and we just have a simple banner just saying, in-network therapist or prescriber. And just having that leads to hundreds and hundreds of signup. I shared that with one of the leaders of the platform, and he was like, wait, what? Just having a little banner there saying in-network therapist or prescriber, and it's led to that without even doing any other marketing? So it just goes to show there are so many people every single day looking for help, and the solution does exist. We serve ages 5 and above for therapy. We serve ages 13 and above for med management, again, in all 50 states. But if people don't know about it, it doesn't matter. And so this QR code that just went up there, if you're interested in learning more about Rula, you can scan that and fill out a quick form. Ryan on my team, who leads employers in this area, is here as well. We have a little table, and Rachel, my head of marketing, is here as well. But if I just leave you with one thing, we can all make a difference, and the impact that you have on mental health goes far greater than just mental health, whether you're thinking about worker productivity, whether you're thinking about physical health. I could share a bunch of stats on how it actually helps you with your total cost of care. But quite frankly, I think that is missing the broader point that if we don't take care of our mental health, what are we doing? So thank you all.